Welcome, everyone. My name is Cheri Pies, and I am with the Maternal and Child Health Program at the School of Public Health at UC Berkeley. I'm delighted to welcome everyone here tonight for the screening of The Raising of America, Once Upon a Time, one of the episodes in this really revolutionary and important documentary that was produced by California Newsreel. As many of you know, California Newsreel is also responsible for Unnatural Causes, which I think is also a landmark piece of work that has really moved the field forward with regard to understanding about the social determinants of health, the influence of economics, housing, transportation, work, environment, migration, and immigration on the health of people. So The Raising of America falls into that category too. It's really designed to help us understand even more vividly the ways in which our children are being affected by the policies and practices that are currently in place here in the United States and that have been the historical evolution of those policies and practices. So I'm delighted you're all here. I imagine we'll have a few more stragglers tripping in, people who think, am I supposed to be at that big event downstairs or that other event upstairs? So I want to take a moment and let you know about the evening. I'm going to introduce Larry Adelman in just a minute. He is the creator and executive producer of The Raising of America. And we'll then show you the film. It's about 30 minutes. And then we're going to have a panel that we've invited to come to both respond to some questions and answer your questions and really have a conversation here about some of the compelling issues that I think we all know are currently on the table with regard to the health and welfare of our children in this country at this time. And certainly we're in very uncertain times for a variety of very complicated and not complicated reasons. So I think we can have a very dynamic and interesting discussion. So let me begin by introducing you to Larry Adelman, who, as I said, is the creator and executive producer of The Raising of America. So Larry and I have known each other for a long time, so we are longtime friends. We go back many years over many types of work. And for those of you who may remember Race, The Power of an Illusion, Larry is the person who created and produced that breakthrough documentary. And that was really a moment in time for many of us to begin to talk about the issue of race and to give us a language to talk about that. And if you haven't seen it, I highly recommend that you take time to find it and view it. It's called Race, The Power of an Illusion. And he's really won many awards for a lot of the work that he's done over the many years that he's been working in this field. So currently he has produced this 5-part documentary, this film series, and it's really a multimedia initiative. It's not just a film, but there's a whole lot more to it. And that blue piece of paper that you have on your seats are questions for people to think about before viewing the film, and it's part of a larger component that's on the website, on the California Newsreel website. If you're interested to look further, there's so many vibrant and robust resources there for you to really take a look at, to begin to not only engage you in the films that have been produced by California Newsreel, but also to help your thinking and stimulate the dialogue that you might want to have with others. I remember when Unnatural Causes came out, I took it home to show my mom when she lived in Southern California. And I made her watch every episode over the course of about 4 or 5 days that I was there, and she finally said to me, "Oh, now I understand what you do." It was like really an eye-opening moment because it was so accessible. And I think it's the same thing with The Raising of America. Every episode is so accessible for people who don't completely understand the kind of work that some of us are doing or who don't understand the ways in which the world is working. So one other thing I want to say about Larry, he is the co-director and head of production for California Newsreel, and that is, it's the country's oldest nonprofit documentary production and distribution center. And he also created and produced Unnatural Causes, and that film received a DuPont Columbia Award. That's kind of like the Pulitzer of broadcast journalism. And it also received the 2009 Best Film Radio Television Award from the National Academy of Sciences and the Institute of Medicine. So the films that he's made has received a lot of recognition and honors, and we are absolutely delighted that he was able to join us here tonight. So Larry, please join me up here and let me Let's give you a round of applause. How was that? Short and sweet.
Thank you. You're making me blush, you know. I've sort of lost my voice last night, so I'm going to do the best I can with this microphone. I'm getting cold. And I want to thank you. It's great to be here, and it's great to be an honor to be part of the folks that you'll be talking with you after the show who've done so much work. Because what we do as filmmakers, we steal. We steal from folks like the folks you're going to be listening to later who do the real hard work. Well, that's our job is just to go out and you know, try to take what we can and put it, translate it to a different medium. You know, so thank you, Cheri. Thanks everybody for braving the weather, and I hope you catch some food from downstairs on your way up. You know, everybody here, I imagine, knows that that with the exception of a few states, California with one of them, is that we're the only rich country in the world that does not guarantee by law, of course, paid parental or family leave. If you lived in Germany, you get 14 months. If you lived in France, I think it's about 10 months. Sweden, 16 months. Canada gets 9. Hungary, 2 years. Same with the Czech Republic. Us, nada. But so as a result, we found 40% of new mothers return to work within 3 months of giving birth. But then the other shoe drops, right? What am I going to do with my kid? Who's going to care for my child? Because, you know, center-based childcare can cost $20,000 or more a year. Programs like Head Start, you know, serve only a fraction of the eligible folks. So it's really a double whammy, a 1-2 punch that parents get. So, on the other hand, we live in a nation where political leaders are extremely quick to say what? Oh my God, babies are so precious. We want to do everything we can for babies and their families, right? They profess to care so much, yet do so little for them. Why is this? And then, in fact, even employ the language of family values, like a hammer, to beat down so many initiatives which can actually make things better for families. So they pound away, and what do we hear? We hear things like, oh, it's an assault on the family, they cry, right? Or it undercuts personal responsibility. It's a constraint on our freedom to choose. It's not government's job, plus, of course, it costs too much. You know, we hear this litany over and over and over again. So where did these messages come from? Now, one of the things I was going to do tonight was actually, I looked back last night and looked at some of the history of child initiatives through the 20th century and the opposition they faced and what won and what worked and what didn't. But I think what I'm going to do is, given the time, is skip that. I wrote notes so I can actually write it up. I'll give it to you if anyone wants that, because I found it kind of interesting. Going back to the founding of the Children's Bureau in 1912, the attempts to stop child labor in 12 and 14-year-old kids were laboring in the mines and mills that we all seen with those pictures of Lewis Hine. And of course, what's interesting is when the federal government, for example, tried to outlaw child labor in 1916 with the Keating-Owens Act, is that the Cotton Mill Association went ahead and they recruited a mill worker by the name of Roland Dagenhart, who toiled for 16 hours a day in a cotton mill in North Carolina, along with his 2 boys, one of whom was 13 and the other was 15. And Dagenhart brought suit. And the suit said, in essence, he claimed that this law was an infringement upon his liberty and freedom to basically reap the earnings of his children. Because none of them were making enough money to live on, of course. And the Supreme Court, in a 5-4 decision, familiar, agreed that this was an overreach of government power to go ahead and use the power of the federal government to help, to ban, to outlaw the exploitation of 12-year-olds in the mines or the mills and elsewhere. And this is a theme that we see over and over again. I just mentioned the Shepard-Towner Act, which many of you folks here know, which was established in 1921 as a way to, after the Children's Bureau, and provided clinics for women and children, and home visiting nurses, and nutrition education, and prenatal care, and all sorts of things. And Shepard-Towner, of course, was attacked viciously by the American Medical Association, along with the anti-suffragists, of course, because remember there was a movement to get women the right to vote, and at the same time, the so-called medical, I think it's called the medical liberty groups, who were campaigning against the licensing of doctors, the need of doctors and hospitals to license themselves. They were also, by the way, anti-vaccination. And these folks claimed that Shepard-Towner was, of course, a Bolshevik conspiracy. It was going to nationalize, these are words they use, you can find it in the record. It was going to nationalize child rearing. And indeed, in 1929, the Shepard-Towner was repealed, not replaced. So we'll rush forward, and I just want to say, when we were starting research for this show, the series, I got this fax from Amy Fine, a wonderful researcher, writer who some of you might know. And the fax simply said, here, she said, "Do you know about this?" And what followed was about 5 or 7 pages from Gail Collins's wonderful book on the history of the women's movement, when everything changed. And, and those pages sketched out sort of the next act in this sort of this 20th century story of when Congress passed a bill that would have created high quality child care and other services for every family that wanted it in the United States of America. I said, my God, I never heard of this. This was 1971. I was an adult, sort of, back then. I was reasonably engaged in the world. Why didn't I know about this? And what I did know, though, immediately after seeing this, is this was a story that we had to tell. Because in this story, I think we see this critical inflection point from the progress, the zigzag of progress in the 20th century that was driven by social movements from after the Gilded Age, with the progressive movement that gave rise to the Children's Bureau and Shepard-Towner, and eventually, then driven by the New Deal, and which child labor was outlawed in the Wagner Act, the Fair Labor and Practices Act in 1938. And in 1941, the Supreme Court finally did overturn Dagenhart and say, yeah, I guess child labor, the government, that's legitimate arena for the government, for the federal government. So we have this movement, and of course then during the 60s, and the 60s, despite the fact, it's interesting when you think back of those who weren't there, is that despite, the urban rebellions and the student protests, the fact was the 60s were marked by a sense of possibility, hope, and progress. And indeed, if you look domestically, there were many social reforms that improved conditions for children by improving conditions for their families. That made us more driven by the civil rights movement and then the women's movement, a more inclusive society, where the gaps actually declined during this period between not just rich and poor, but between black and white. Those gaps narrowed. And then we get to this critical inflection point, and that's the story that this show is about. So as you watch, just sort of listen for what that story teaches us for what drives social justice forward, and how the language of freedom, the language of family values can be lashed to politics and power in an orchestrated campaigns to thwart those efforts. And we'll continue that, to pick up that discussion after the show. But watch it with that in mind. So.
So we thought it would be great to have a discussion with a few people to hear a little bit about their impressions of the film. So I want to let you know who's here with us tonight. We have Sylvia Guendelman, who's the chair of the MCAH program here at UC Berkeley, the School of Public Health, and she's a leading researcher on maternity leave. She's published widely about it, recently received a very distinguished award for one of her articles, and I think many of you know Sylvia as well. Marcy Whitebook, who is the director of the Center for the Study of Child Care Employment, who has produced some very impressive reports about childcare and employment and issues that I think all of us should be reading about on a regular basis. Then Malia Ramler is the senior administrator at First 5 Alameda County, and we're delighted you were able to join us tonight. Eric Coker is a postdoctoral fellow here at the School of Public Health with the Center of Excellence in Maternal and Child Health, and also a very proud parent. And then we have Larry Adelman, who I introduced previously, so I'm going to not embarrass him anymore with that. So we had a couple of questions that we wanted to pose, but I thought perhaps we could start by just getting an initial reaction from all of you of this film. I'm not sure if you'd seen it before or not, but if you could just say a few words about your own initial reaction based on who you are in your professional world or your personal world and what it said to you. So Eric, would you mind giving it a start? As a parent, as a proud parent?
Sure. Thank you for putting me on the spot, Cheri. No,
Yeah.
I'm just kidding.
It's good practice.
Yeah, it is excellent practice. Thank you. My initial thoughts are, well, obviously it was an excellent film or short film, and as I was watching it, I was just constantly thinking about my own personal life and not only just being a parent, but also thinking back to, 20, 30 years ago now, I guess, is it now, when I was a kid and thinking of the struggles that my mom had as a single working mother, working full time, and just kind of piecing together from my memory how she managed to make it work. And I know it was a major struggle, and so, it boggled my mind that my brother and I, when we were facing that, my mom, when we were facing that situation, if that bill would have passed, a lot of key developmental things, we would have had the opportunity to have, quality child care. My mom was always scrambling to ensure that, when my brother and I were not in school, that there was some coverage for us, whether it was a neighbor or where my mom chose to, rent an apartment from was across the street from my dad's grandmother, so that we could have some coverage for child care. And it was just a big patchwork of bandages to secure child care for my brother and I. And so it just startled me to know that would not have been the case if this bill had not been vetoed. But I think I'll talk more about my own personal situation with my kids and childcare, because I have a lot to say. But I do want to open up to other panelists. But those are my initial thoughts.
Great, thanks. Malia?
I guess one of my initial reactions is I wish it felt more unfamiliar. That there's so much about the dialogue around fear and the dialogue that twists what it means for us to support families, and the dialogue about the deserving and the undeserving just feels so familiar. And I really think when I see this about the opportunity cost. And from where we sit at First 5 Alameda County, we look at the kindergarten readiness of our children as they enter school, and try to track that and understand what the drivers of that are. And so we know that one of the primary drivers, one of the largest predictive factors of entering kindergarten ready to learn, really is participation in high-quality childcare. They reference the research in the film, and our local research continues to affirm the truth of that. And so the opportunity cost of what it means when we know that right here in Alameda County, only 44% of our 5-year-olds enter kindergarten ready to learn. That's not enough. And so on the one hand, it's depressing how familiar it all sounds, and it's depressing to think about, as I said, the opportunity cost, what we know about unmet need right here in Alameda County, right here in California, what that means for kindergarten readiness, what that means for children's opportunity. And the other thing that it makes me think, though, is the optimism and the call to action about what we can do and what we're seeing local jurisdictions do all over the country. We've all been sort of following in the news, New York City's massive scale up of universal preschool, and they're not alone. There are many jurisdictions, many states that have really taken this on, Oklahoma, North Carolina. And if they can do it, we can do it. And if we can't count on the federal government to save us, and I'm not thinking that's happening anytime soon, getting busy locally about the call to action that it all represents.
Thank you. Marcy.
I'm impressed that you could get upbeat.
I'm trying.
Yeah. You know, I know this history, and I was just shocked by how upset I sort of feel like I'm on the verge of tears, and I cry when I'm angry or when I'm frustrated and when I'm sad, and the whole story just gets me, you know. And partially, for me, I was a Head Start volunteer that first summer of Head Start. And when I finished college in 1970, my first job was in 1971 as a childcare teacher. And so this was sort of all going on, which I kind of knew, but I wasn't really immersed in the policy part of it. But I thought, well, if it had passed, to your point, I would have had a totally different life, because I've spent the last pretty much almost 50 years trying to get an equitable early care and education system in the U.S., and one that's good for kids, good for, affordable for parents, but also for the people doing the work, values their work, and so people don't have to live in poverty to work with young children. So, I read this, and I have been reading some of the conservative proposals that are coming out now, because, it's early childhood is kind of a bipartisan issue again, but really people are talking, it is really a recycling of a lot of the same arguments. And I just read something the other day about how we don't want to make it too generous, because it will encourage parents to institutionalize their children. And you're like, oh, come on. But, and it's real, and we know. So I guess partially as I was watching it, I was going like, God, Buchanan and that team are still calling the shots on this issue, and we have not figured out a way to get around it. And I actually feel in a lot of ways the early childhood community and the advocates have, they talk in Europe about the idea of the dictatorship of no alternatives. We've sort of narrowed what we think we can ask for, because we just don't have a way of coming around that and thinking about it differently. So it really made me think, like, we have to figure out a way to build a movement around this, which we don't really have. And I know this wasn't, there was a movement behind this that's alluded to. There certainly was a movement, much more so than there is now, around World War II in terms of who pushed for childcare. So anyway, there's a lot more I could say, but I found it incredibly moving, and it's really important that more people know about this, because it does give people a sense of, oh, we're not the first people to think that this is a problem we need to solve.
Thank you. Sylvia.
Yeah, well, great movie, thank you. Moving back, it's 1976. I'm a student here in social welfare. Marcy, I think, is in the second cohort. I think
in education,
I'm in the first
right? Yeah.
cohort of, we are Carnegie Foundation funded fellows to explore the importance of childcare to families here in the United States. And we are capturing that fever, that interest in how could we make childcare better for children and families. At that time, I'm a student, doctoral student, social welfare. My dissertation is on how can families cope better? How can parents really facilitate separation from their children who are entering childcare? I'm interested in infant childcare, the first 18 months of life. What can we do so that we can leave children in childcare not feeling guilty and ensuring that our kids are going to be very well taken care of at UC Berkeley's childcare programs? Because so many people are even looking at me saying, what? You leave your child in childcare? What's that about? Fast forward, it's 2017, almost 40 years later. I'm a grandma. And believe me, I run around a lot with my two grandsons because my kids, the kids' parents work and they need all the help they can get. And even two sets of parents, of grandparents, can't really make up for all the increasing demands and complexities of raising children in modern society, because it isn't getting any easier when we have to dial in and say, well, the robot machine isn't going to answer. You're not going to get the human touch. So there goes another 15 minutes wasted on the phone just to get a simple question answered. So I think that, yes, there is a crisis in America around childcare. Interestingly enough, over my career, chose to focus on maternity leave because my feeling was that it has to start even earlier in the prenatal period. What is it that parents can do before they get exhausted and fall into that delivery table to then have to be superwoman to sort of start taking care of these infants while they're worried about when they have to return to work, which on average is 12 weeks after they deliver. So there is a crisis, and I just want to end by saying that it's no wonder in a way when I come full circle and I sit at meetings at Children's Hospital, UCSF, and we think about what's going on with pediatricians who are serving children, and why is it that we need to focus on all these stresses, all these children who are coming in absolutely stressed by child abuse and incest and toxicities that poor families face, and that has become sort of the most pressing problems for pediatricians when it could have been averted. It could have been prevented with good family supports such as that.
Thank you. Those are great opening remarks. I don't know, Larry, if you had something you wanted to add to that? No. So let me jump off from that to ask you a broader question that Eric kind of touched on, but I'd like to hear what you have to say. You know, how would the nation be different today if high-quality universal child care had been available for the past 4 decades? You know, what, Marcy, what might be different?
Well, I'm sorry, but we would have a lot less poverty among children and among women. I mean, think right there. Right. That would be very different. And I think that people don't stop to think how much childcare is driving child poverty. And you know, when parents are paying, you know, such a high percentage of their income for childcare and they have to work. So I think right off the bat, that would be one thing. There are many other things, but.
Well, I think that this is an important, I mean, those of you apparently, particularly who have a lot of history with this, I think it's important to articulate how things might be different. You know, the world would be a different place.
I'm curious, how many of you have ever heard of something called the Heckman Equation? Show of hands. The Heckman Equation. Show of hands. Because I think the Heckman Equation, in some ways, and his work, responds to your question. So James Heckman is an economist at the University of Chicago, and he's a smart guy. He's a Nobel laureate. And he does the economics of human development. And he's been following a data set, a longitudinal data set of kids from comprehensive high-quality childcare from programs in 1971, when this film was made. And those children must be in their mid-40s now. And he's been tracking them. And so when you say, so what if this had been comprehensive? What if everybody had gotten what these kids that James Heckman has been following had? And he has a few things to say about that the most effective investments are the ones that started at birth, so kids who had care from birth to age 5, that addressed both cognitive as well as social emotional kinds of skill sets, and included support and education for parents. And he would say that we're way too focused right now on the immediate cognitive outcomes of childcare when we ask if it works, what do they look like when they enter kindergarten, but that the long-term benefit is really where it's at. And what he shows is more likely to graduate from high school, higher employment, not only for the child in care, but for their parent. So as children learn, parents can earn, to Marcy's poverty point. And interestingly, gender differentials, so that boys in particular, in addition to those things, had lower rates of drug abuse, lower incarceration, and better health outcomes. And all of that, when you looked on at the cost of those things not happening, was in terms of a public investment, annualized return per annum of about 13% for every dollar spent on those children. So if you extrapolate that to all the children who might have been served had this happened, and we're looking at long-term health outcomes, potential for earning, better health outcomes, I think we would have been in a very different place right now.
I'm so glad you mentioned James Heckman, because I think his work is really pivotal in understanding how children's futures have been, dreams have been deferred by changes that have been made in the policies here in the United States. Thank you.
Can I plug, and one of the other shows in our series, this is a 5-part series. There's an opening hour, and then 4 half-hour shows. And one of which, called Are We Crazy About Our Kids, includes the work of Heckman and others who've studied this. The returns, the longitudinal studies over decades to show how childcare pays for itself in many ways and many benefits.
So one thing I would want to add, I totally agree with what you said about the issues with poverty, and then the trajectories of children later on in life, these impacts that these kind of child care development centers would have had. But I do also want to comment on the broader political impact it would have had. And it was kind of alluded to in the film, we're constantly riddled with the rhetoric of freedom and liberty and the nanny state and these sorts of awkward phrases that really have no kind of bearing in reality. I think if this would have passed, I believe, a lot of these conservative, philosophies, a lot of them would have been stamped out. This kind of essentially empowered a whole generation of conservative ideology that, denied, actual, it has allowed us to, conservatives to deny things like climate change, deny science, deny all kinds of evidence-based, what's the word I'm looking for? Collective effort that it takes to rear not just an individual but a whole nation. All of that, I really believe, if this had not been vetoed, it would have opened up a lot of more opportunities politically, and now we have such a narrow road to go about politically that you would have essentially had a whole generation of children raised. I do believe a lot of families, believe it or not, would have institutionalized their children, and I'm quoting that because people would have opted into this, and there would have been a whole generation that saw, okay, I see this benefit of of being able to have quality child care. So from the child's perspective and the parental perspective, it really would have opened up a whole nother, dynamic that was really shut out. And so now we have, a lot of the letters that were sent to the politicians at the time, it really reminded me of those town halls during the Obamacare back in 2010, if we can remember that far back, because a lot has happened since then. But a lot of that same rhetoric was used to attack the Affordable Care Act, I really think, I'm saying this is probably not an evidence-based thing that I'm saying, but I have the inclination to believe we wouldn't have seen such empowerment of those, false ideas to stamp out good public policy that cares for people. So, just from a broader political perspective, I think that was a big takeaway from the film.
Anyone else?
Yeah, beyond what I think I'm saying, that it has almost weakened the family, the lack of these supports, because when childcare goes, so do many other social supports go. And that is what I think is most frightening right now about this rhetoric. But I think the rhetoric, when it is kind of convenient politically from conservative movements, falls into family values. And when it's not, it's in denial. What do I mean by that? My sense is it's convenient to hold on to family values that are, like George Lakoff, our linguist here at UC, has called the vision of the Republicans thinking of the authoritarian father, who in those families, the value of the father is the father dictates what you're going to do, and that's what we do, and you pull yourself up through your own bootstraps. There's no government interference. The Democrat approach has been one of the authoritative rather than the authoritarian father in Lakoff's terms, where parents are more empathetic and share and more democratic with their kids. I think that we are moving towards this very authoritarian form of government, where again it's like family values are important, but you do it any way you can. And that's very scary, because Ivanka Trump, I understand, wants to push childcare.
Right.
That is one of the things that she supposedly committed herself to do. But again, it is a model that is going to be directed predominantly to more affluent working women, and the poor are going to be left behind. And in this whole family values ways of playing things out, in which the government is going to be divesting rather than investing in children, it's, I think, very interesting to me that when we have had immigration to this country, the way Mexican immigrants have come to this country to fill a very important need, not only for work, but to boost our fertility rates as we become an aging society, that the family values of Mexican immigrants, for instance, which is you work and you have children and you're proud of your children and you take care of these kids. But those family values don't count. For that, we better invest in a wall rather than invest in healthcare. We better invest in a wall to keep those people out, but without the foresight that if we don't have immigrants to boost our fertility rates, we're going to go the way of Japan, which is a society where there's so many elderly in relationship to the population size. such a low, one of the lowest fertility rates in the world, and it reflects on their GDP. The GDP cannot grow now for more than 20 years, partly as a result of these low fertility rates. So it's all tied. How are we going to make America strong without strong families? How are we going to make America strong without strong family supports and the interest in fertility and reproduction if we don't support women's health, we don't support family health, and we don't support the people who really bring in the family values to bear in this society?
Marcy, did you want to add anything? Because I was going to build on what you just said, Sylvia. I also want to give the audience a chance to ask questions if you'd like, but just one point here is, I think with Sylvia, what you said and what Marcy was saying earlier, and building on Malia and Eric, I think that this is a time for action. And it's clear you have some ideas of what action can look like. I think you gave a platform right there, Sylvia, around women's health, reproductive rights, and the importance of children. But maybe could you speak a little bit to what that action, Marcy, I think you yourself were saying, it's time for a movement, some action. Is there something more that you think you could say, or maybe there are people here also who have some ideas about what is something we can do? Because I think there's a sense of there's a need to do something. We don't want to let ourselves feel powerless. We want to feel that we are emboldened to move forward in a way that could be beneficial, not just for the children today, but for the future of the country.
Well, one of the things I think is really important is that people actually become critical thinkers about childcare proposals, because I think it gets very confusing. So many American families are touched by childcare problems, and pretty much on the right, to the extent that they talk about childcare problems, it's about only the affordability side, not the quality side. The idea is like, we'll leave some of the burden mostly on people who can carry the burden more easily. And so I think we've been trying to work on helping people to think about what does good policy look like? How do you read a proposal comes out and read through the rhetoric to see what it's really saying. So, we just did a little piece at our center with the Economic Policy Institute called "What is Good Childcare Reform?"
Excellent.
Which just lays out, the ways for people to read what's coming, see what's coming in the paper. I think, but there is a problem, which is that the early care and education system in the U.S. is not. There is kind of a system, because over the last 100 and some years, it's not like that bill didn't pass and nothing happened. We left it mostly to the private market with some government intervention. And so it's really the luck of the draw, the way our system is, depending on if the people define the service as education or childcare, you get one whole different set of standards, and you get a whole different source of funding and a level of funding. And that we basically say, well, low-income children and low-income families, not low-income children, but children from low-income families, those families should get some support, but we only provide enough support for a fraction of the kids who qualify for it, or the families that qualify for it. That's true for Head Start, that's true for pre-K in most places. That's also definitely true for childcare subsidies. And at the same time, because there's so little money in the system, that even people who qualify don't get it, or the amount we use to fund programs is so low that we're really relying on the 2 million people who are paid to care for and educate young children to subsidize the system. And that's a problem in and of itself. So I think, but it gets very complicated, because a 4-year-old in California could be in a program with a teacher in a program like TK, where they have a credentialed teacher that's totally paid for, or they could be in exempt childcare program where the person might not have a teacher or a provider who's had any training, and everything else in between. And so the way people perceive the problems is not unified, so that when proposals come out, you have some people liking it and some people not liking it. So I think what we're trying to think about is how do you get people to, are able to say, like, let's not go for the Trump proposal that gives a little bit to a few rich people through a tax credit, but let's hold out and articulate what it is we really need and begin to build support for that. Of course, I say that knowing what's just gone on around the ACA, and you kind of think if this had passed, you would have had people sort of saying, oh, I don't want government invention, but don't take away my child care.
Right.
Yeah.
You know? So,
It would have been just like that.
right, but I do think it's getting ourselves to be more educated, political players in this, because if not, I don't think we'll ever build a movement.
That's right.
And there's some really small, specific political things
Yeah.
we could do as Californians.
Yell at
right-
Jerry Brown.
Right now, yeah. I mean, just to get really concrete about it, right? So during the recession in California between 2008 and 2013, we lost 31% of our subsidy childcare slots. We lost more than 100,000 subsidized childcare slots in California. And in the last couple of budget cycles, the governor said, we're going to begin restoration. And in the last couple of budget cycles, the restoration brought back about 20,000 of them, which isn't anywhere near where it needs to be. But the promise was to in the last couple of budget cycles, to begin growing that again. Well, we're scared about the impact of this federal administration on the state economy. We're worried about what changes to the ACA will mean to the state economy. So the governor has paused restoration. He said, yeah, we committed to a really weak percentage of what we need to do, and yeah, we promised, but we're going to pause. So what Marcy said, we need to be active with our state legislators and governor about, no, we don't need the pause. We need, at minimum, full restoration. We're still at about 160,000 income eligible kids who are 3 and 4 in California, who have no access to any kind of subsidy care. And then Marcy said TK, which stands for Transitional Kindergarten, which is which is a new grade in California. It's only a few years old, and if you're a 4-year-old, if you're a 4-year-old who's a little bit younger, our laws say that you shouldn't be in a classroom bigger than 16 to 20 children, and you should have 1 teacher for every 8 kids. But if your birthday is 2 days later, you go to transitional kindergarten, and then it's 1 poor teacher all by yourself with 24 4-year-olds.
Oh, gosh.
And they're all 4-year-olds. And so there's things like that we're parents, we live in school districts, we have opportunities in our school districts to say to our school districts that our local funding formulas need to include not just kindergarten through 12th grade, but transitional kindergarten, and the way that school districts have their child development programs. I have been at school board meetings where school board members literally react with surprise to the fact that as a school board member, they have 1,600 preschoolers that are part of their school district. They're like, what? So I think we all have opportunities to keep young children at the table. We have, those of you with little kids know little kids don't like to stay at the table. So as grown-ups, we have to stay at the table for them at our school boards and with the governor and that kind of thing. And when we do have opportunities locally to look at legislation critically and using tools like Marcy develops to look at it critically, to keep them at the table.
Can I just say one thing that I think would be really simple for people to do?
Will you pull the microphone slightly closer?
Yeah, just one simple thing is that in the U.S., because our system is divided between childcare and preschool, the way we think about it, and it's like really, that split between care and education is also what trips us up, because people will push for childcare or people will push for pre-K, but we really need to be thinking about getting people to say, children, no child says, oh, I'm learning now, no, I'm being cared for now, I'm learning now, I'm being cared for. It's all one and the same, and in fact, a lot of countries do split their system like that, but I think where we get traction on pre-K or preschool, then that often comes at the detriment of getting traction on childcare, which is often for the youngest kids. So we need to say, it's not either or, it's both and. And, getting people to start thinking more in terms of what we really need in the context of making, working on local stupid rules like the TK ratio rules, but because I think that's part of it's part of what we need for people to be thinking about what it is we ultimately want in terms of good reform. So, anyway, sorry.
Eric, I saw you wanted to say something.
Well, I completely agree with what's been said here. But one simple thing I think that we can do. So let me just take my situation for example. I have 2 kids, 2.5 and a 1-year-old, and currently, I'm working full time. My wife stays at home with the 2 kids, and my wife is an immigrant, so she doesn't know much about our system of childcare, much if anything at all about it, and so we've struggled to maneuver that. We make too much for Head Start, and we sure enough do not make anything close to what it would take to afford quality childcare, and so our struggle is to, find some way to get her for her to get her education, but. So that's my personal situation, or our family's personal situation. But we can very easily identify with somebody on the conservative spectrum can very easily identify with that very scenario that I just laid out to you. So one thing that we can do is identify that person that we know is very conservative, but we know they have 2 kids and one works full time, the other one stays at home, or they're both working full time and they're struggling. So opening up dialogue, sitting down with a film like this with them, on top of, the critical thinking and being aware of the subtleties of these different policies locally and nationally, but really communicating with the people that we know that, look, we can find very sure common ground on this issue, and so if you make a connection with that person and then they reach out to their legislator, that this is an issue that we can definitely find common ground on, because it's across the whole political spectrum. The 99%, if you will, is struggling with this. 99% of parents are struggling with this, so there's no doubt that this can be a bipartisan, I hate that term, issue, but there's a lot of hope if we actually communicate with people and talk about it as a real thing we can reach agreement on. So
Thank you. Well, Larry, did you have something? No.
Yeah, but most of what I would say would be from things I've learned from others. So let me go ahead and pass for that and move on.
So, I know we're getting close to our time to end, but I wanted to see if there's a question from the audience that we could entertain. Yes, let me come right over here with my microphone. There you go, Carol.
I just want to thank you for making the film. I thought it was really profound, and I had many of your reactions, Marcy, of feeling like my blood pressure was going up the charts, and I felt very frustrated, like crying. And so my question would be about the status of women in general in the United States. We just had a big women's march. It went around the world. Think of all the countries that have subsidized childcare that you've named as a panel. And what is preventing us as women from focusing on the affordable childcare for the first year of a child's life? I mean, if we're going more towards a libertarian, individualized, take care of your own philosophy in the United States, where we've got Betsy DeVos as our education department, and it's like everybody, you're out for your own, you can have anything you want. But this is something that is a profound issue for women to look at. This is a collective, like the wages of childcare workers. What's the difference between daycare and education? Why aren't the wages and the why isn't this considered a status job? Is a teacher considered a status job? And so it's like, this is a very profound film to think about how our country is not really honoring, working collectively. So my question to you would be, as a starting place, how do we get family medical leave?
That's a big question for a short amount of time. But
They would just listen to me.
Elect Marcy.
Do you want to anyone want to take a stab at what I think was a very succinct and important point, and a question that I think should be on the minds of all of us?
Well, you ask a really important question that I share and ask myself every day. And you ended by saying, what about family leave? And in California, we have this model of maternity leave and family leave, which is predominantly based on employee contribute this money to this social disability pool from where we actually kind of pay ourselves for the privilege of taking, under that law, paid leave, but that isn't job protected. The job protected comes from somewhere else, because nothing is easy in this country about laws and regulations. But you start wondering, Marcy, and you start a movement, whether it is a movement where we begin to contribute to a special pool of money, little by little, where you kind of pull together a source of funding for childcare, the way we've been doing successfully in California for maternity leave. I wonder if that is something that begins to be more at the beginning grassroots and pulls people together and creates a movement. And you're also giving the message to politicians like, we're not going to rely on government to tell us what we can or we cannot do, because if that's where we're going, it's not going to look very good for the status of women. So it's an issue to be thought about.
Let me just chime in, if I may, quickly. Two things. One, your job is not protected unless you work for a company that employs 50 or more employees, if you take paid leave here in California. There is a bill, SB 63, which Senator Hannah Beth Jackson from Santa Barbara has introduced to the Assembly, which will lower that threshold to 20. Companies which employ 20 or more. There are millions of women who don't take parental leave who qualify for it because they're fearful that they will lose their job if they do. This will help that. Secondly, I would say, and back to your question, one of the things I think folks here like Janice and others know is how siloed this particular field is. One of the ways in which progress is made, obviously, is by working together, building alliances. How can we, in fact, can we use I would ask, can we use perhaps the lens of the young child, and all of which, not just where some of us are parents or grandparents, but we've all been children. So we all know what it's like when your parents have faced huge stressors, and which make it more and more difficult for them to be the parents they want to be, and give the care that they want to, and the nurturing that they want to their kids. So perhaps, we're using this, because there are many things. Child care is one part of the puzzle, but we need to, when working together, building those coalitions and alliances, and beginning to have those conversations with different sectors who are affected, whether it from not just parents, who of course young parents are completely overloaded with time, but anything, even police, who in fact end up in part, when kids run into trouble because of the stressors that their parents face, that has consequences, as we talked about before, down the line. There are many ways I would just argue that, that beginning to have those discussions across sectors, as cities, by the way, cities and counties are doing that. They just started in Santa Cruz County, they just last week earlier this month, have formed a new countywide coalition called, I don't know, something like Fresh Starts for Kids. I don't know what it is, but it's a multi-sectoral effort to try to do this, and cities after city are beginning to do that as well, and Janice can probably speak to all of this better than and Cheri as well, of course, with the Best Baby Zones work that you're doing. I think there's really lots of ways of things that we can feel good about. You know, we came this close 45 years ago. We really did. I mean, there's something, we can take heart in that as well. Gosh, we came this close, you know. What's going to take to get over that hump?
Well, Janice, yes.
I think one of the strongest voices.
Wait, I need to bring them back.
Something that we're in a way missing are parents themselves. They're the strongest voices advocating for access to childcare. Parent Voices in California has done so much at the state legislature and so much locally in terms of pushing and promoting childcare, coming from low-income families themselves who are struggling and dealing with this. So how do we support those women and families to do the work that they're doing, because that's what's making a big difference as well. So.
Thank you. Well, in the interest of time, I'm going to bring this part of the discussion and evening to a close, but I want to encourage people to stay around. We have some treats back there. Our panelists will also be here. I want to just say thank you. First of all, thank you for making this film, for being part of a community of people who are thinking about these issues and are telling the truth so that we can see what the history has been and where the future could be. I think it's an important legacy that you leave and that you set a stage for so many people, young people, and those of us who are still fighting the good fight. And thank you to each of you, both for being here tonight, but really for the ideas that you bring to the table, for the work that you've done that has brought you to this place, and I think stimulated some thinking among not just in the moment right now, but I think for people who are going to be moving forward in the field as their careers unfold. So I want to say a heartfelt thank you. And I'm glad all of you could be here. I welcome you to mingle and talk with all of us, because this is an issue that is of the moment. And we are the ones that are going to make the difference in the world today. And so I give you the mantle to get out there and do something. And with that, I'll close the evening, but welcome you to the